Marwan Cameron, and this is the Conduit. All right, y'all. It is officially June 5, 2021. It is almost 1 a.m. in the morning. Got a lot to come to you with. In this show today, we're going to go over vaccine updates. A lot of stuff happening out there, both locally and nationally. So I want you to be informed. As you know, I received my first vaccine 3 weeks ago. And it is now time for me to get my second Moderna shot tomorrow morning at 10 a.m. So I will be going and getting my second shot tomorrow. And so, I recorded getting that first shot. And the Marvel Wave Center sent me this reminder for tomorrow to confirm that I was going to come to receive my second dose at 10 a.m. So I will be there tomorrow to go ahead and do that. And as I said before, I will be recording and bringing you video updates every day so that you can see how I'm doing, because I think that's important. Something else that's really important is, as you know, a lot of us have been very apprehensive on getting the vaccine for all the different reasons that we have talked about ad nauseum. But, we all have to come to those decisions on our own. And I've shared those reasons with you why I decided to do that. And so, through that, Rob, who is, a friend, first of all, but, also a board member and one of the founding members of G2, also apprehensive, decided to, get vaccinated also. And so he wanted to support the fact that I had made that decision. We've had ongoing conversations that you've seen since I think we started those conversations December, actually, in some of our podcasts that we've done. And so he received the Pfizer, and he received his second dose on the 4th, on Friday, right, at 2 p.m. So he got a second dose. He said that his arm was hurting. He got his dose at his second shot at Walmart. He actually got it from the exact same person. He did report that the second needle was a kind of brutal. And he said the phlebotomist was kind of rushed. They had an onslaught of walk-in appointments, which I think is a good sign, right? I mean, if you have all of these walk-in appointments and they're feeling rushed, that's a good thing that, people are making this decision to get vaccinated. So I guess he kind of just stabbed it in there pretty hard. And so he is pretty sore. His report on the Pfizer was he went home and got sleepy after a few hours. He did lay down and he took a nap. And then he got up after a couple hours and he reported that he was feeling okay. So we'll continue to check in on him and see how he's going. And I think that's perfect that he and I both received either the Pfizer or the Moderna, pretty much at the exact same time within a 24-hour period. And you'll be able to kind of follow our experience as we, navigate whatever side effects may or may not happen. So we'll be bringing that to you. Another thing that I think is really powerful and important is, his wife, shout out to Stephanie. They celebrated their 28-year anniversary earlier. So, again, shout out to, the institution of a long marriage. That is a long time. I don't know what I have done for 28 years. I don't think I've done anything for 28 years aside from breathe. But that's a long time to be with the person. So congratulations to them. But Stephanie was very much like, I'm not getting the shot. I don't care if my husband's getting the shot. I'm not doing it. And I'm glad, Marwan, that Rob wants to stand in solidarity with you, and you guys have a lot of conversations. But I'm not doing it, and that's where she was, right? And we respect that. But as it got closer to time, the weeks were going on, and, with the Pfizer, it's 3 weeks. The Moderna is 4, which is why Rob got the first shot after me, but got the second shot before me the day before, right? It's kind of weird. But she decided today to get her first shot. And so he received his second shot and she received her first shot. Same thing, arm a little sore. That was it for her first shot. Other than that, she's feeling fine. And so, that's really powerful. And, we don't want to, take for granted, the folks that do decide to make these huge, decisions in their lives, to change their mind and to, get vaccinated, right? We have these conversations all the time. I attend the Kids at Public Health Zoom meetings. Shout out to Holly and her crew over there for the invitation to be able to ask questions and get information, and how transparent they are. That's very helpful, right? And again, she didn't have to do that, and she decided to do that. And to that end, Ernest, which is one of our drivers, he is going to be receiving the vaccination next. And so he will be completing his vaccination before August. Again, this is a young, super healthy guy. Doesn't feel like he really needed the vaccine. But again, because of his family, he is being supportive to his immediate family and also to G2. So, we appreciate that. But that has taken a lot for folks to really kind of move, across that spectrum of, no, there's no way, you can't pay me. I'm not doing it to, I'm a little tepid about it. I'm not really sure. Yeah, okay, fine, I'll go ahead and get it. Especially now, right? Because there's, the conversations of, hey, it's summertime. Things are opening back up. You're going to spend more time outside. People are thinking they're going to be less likely to get sick, as it's warm and everyone is doing their thing. And so it would be even easier for them not to do it right now. So I think it's, really want to commend them and applaud them for their decision to do that. And then I have one other report, and you guys know Mr. Zulu himself, Brother Raymond. Brother Raymond is he's got a conspiracy theorist bone in his body, and it's a pretty big bone. It's probably a femur, but he is very skeptical, and with good reason, right? And he probably, out of all of us, was the most, hell no, I'm not getting this thing, out of everyone, right? And so, kind of just shared some information with him, because he didn't really know, my health situation, because it's not really something that I talk about. As I said, I try to use my life experiences, the good and the bad, as anecdotal testimonies, or, if you will, or evidence on what you may or may not want to do, or some things that you may want to consider. And so, I shared with him, why I was making that decision, because he and I don't really talk about the vaccine very often, because he's so very staunchly against it. It's like, hey, we know your position. You're not changing your position. It is what it is. Don't talk to him about it. That's what it is, right? So we haven't really had those conversations. And, also, that type of person that, just spends a lot of time dwelling on, whatever my health issues are, because there's work to do, and there's a lot of people that need help. And it's just not productive to kind of sit in that space, right? So it's like, it is what it is. We're trying to help as many people as possible. And so the show must go on, right? And so that's, I try to live by that. And, but at the same time, I am getting the second shot tomorrow. There are a lot of reports that people do get pretty sick on the second shot. And so, I need to let him know, hey, getting the second shot tomorrow, probably likely I'll be sick for a little bit. Rob got his second shot on Friday, so it may be likely that he gets sick. And so just understand that, two of the heavy hitters are going to be, not at 100, if not more like 20 for a little bit. So just want you to be aware and informed, right? And so, he kind of took it a little hard because, again, I don't talk about it. So, and you can say, okay, well, you have sarcoidosis. And, folks aren't necessarily going to go and start doing research like, oh, well, what is that? And what does that mean? And what's the impact? And so I kind of explained those things to him. And shout out to Raymond. Pretty much the first thing out of his mouth was, I'm going to get the shot. I'm going to stand with you in solidarity. And because you're doing this, I'm going to do it. And that's it. So going against everything that, how strongly he feels about the vaccine. And, he's a very healthy individual, as you've seen. He's like, I'm just doing it. So that's it. I informed him like, Raymond, that's not necessary. I respect how you feel. And, I wouldn't try to pressure you into getting the vaccination because I know how you feel, right? We can have a conversation. I can tell you the facts as I understand them. I can provide data and we can talk about, both sides of the issue. But I wouldn't ask you to do that. And I tried to make that as clear as possible. Like, I appreciate that, you don't need to do that. But he was definitely dead set on doing that. So tomorrow he will be receiving his first vaccine. You got to find folks in your life, build your circle of influence, build your circle of support. Those aren't relationships that I can buy, either through money or through other means. That's a big deal. That's a big deal. And it's a big deal for men, especially, heterosexual men, to be able to love and respect each other and to want to support and help each other out. And so, salute to Rob and to Raymond for that. Because, again, they both felt the way that they did about this vaccine and weren't going to do it. And through the respect that they have for me and our friendship, and them, understanding that I'm informed, they've decided to receive the vaccine themselves. So very moving. I really do appreciate that. And those relationships are really important. So as it stands, a good portion of our board, I would say a little bit more than half now, will have received the vaccine. And as I was reporting back in December and January, aside from Roderick, who works in the medical profession, no one on our board was getting vaccinated. They weren't doing it, myself included. It was a thing of we will wait and see, but we're not doing it, right? And the concerns are valid, right? Okay, well, there's this vaccine, there's side effects potentially. What are the long-term side effects? You're trying to weigh those things out. You like to see, how people react after a year or two, and then you might feel a little bit more confident in receiving the vaccination. But as I said before, for me, through the research, through the conversations with professionals and doctors that I trust. Looking at it and weighing it on balance was far better decision for myself, my friends, my family, Layla, for me to get vaccinated. And so I did that. And without expectation, the rest of my family has decided to follow suit and do that. So I'm really appreciative of that and of them. So I wanted to just kind of share that with you because I think that's important. And I think that's how we're ultimately going to make the change that we want to see in our lives, right? And in our community. And that's really where it starts. So I do encourage you, if you don't have those relationships in your life, start to reach out to people. I know it can be hard to do. Many of us have been hurt a lot in the past through relationships that we've had, whether they're romantic or platonic or for just friendships, acquaintances. And so we may be, very hesitant to allow ourselves to open up and let folks in for fear of being hurt again. So, go in cautiously, dip a toe in, but do that. You do need to create and cultivate your circle of influence and your circle of support. So let's go ahead and keep talking about information that's going on here in the community. So I showed you I'm getting vaccinated tomorrow at 10 a.m. and Raymond will be with me to get his first shot. I'll be receiving my second shot, and then I will vlog about that on a daily basis so that you can see how I'm doing, and I will report that out. As I said before, Rob received his second Pfizer vaccine yesterday at 2 p.m. and his wife received her first vaccine, and I'm assuming that she got the Pfizer yesterday, but I will confirm that with you. But I'm at the Kitsap County website here. So this is the Kitsap Public Health District. So I wanted to just kind of share some information here. If you ever want to know real-time information, this is the place that you want to go and get these answers. Now, I told you I was invited to their weekly Zoom meeting. And so Dr. Gibb Morrow is there and several others. So it's really informative. I love the fact that, again, they're very transparent. You can ask them questions. If you do have questions or concerns, you can ask me or send them to me, and I will bring them forward on your behalf and then share that information out. But this is their newsletter. Cases continue to decline, but COVID-19 is still spreading widely in our area. So that is important to note. I think we're going to have, quite a bit of conflict. I think we're going to have some issues. We've had the way our national government and our local government has kind of responded to the COVID situation has been just terrible. But with the CDC saying, hey, you can open up if you've been vaccinated, you don't need to wear a mask. And now everyone wanting to not wear their mask. I think this is going to cause some concern because people will start to undoubtedly look at it like, hey, you know what? It's just not that serious. But I wanted to, remind folks that if you go back to when we shut down last year, at the end of February, beginning of March, right? We were losing, I can't remember how many people per day, 750, 1,000 or something like that, right? And it was alarming, which is why we shut down, right? And that was the very beginning of COVID. And from there, we watched as the number spiked to 4,000, 5,000, hospitals are closed, hundreds of thousands of infections per day. It was crazy, right? Well, the thing is COVID's not gone. There are still people dying every day. And those numbers are back to, let's say, 750, 1,000 people, whatever it is. But we have that COVID fatigue, right? So because it got so bad for a while, right? And we lived through that once it gets back down to the numbers that triggered the close in the first place, well, it just, we don't feel it the same, but those lives that are lost are gone, whether they're the breadwinner. I mean, it's impacted, whole families, children, it's a loss, right? It's a loss. These people have lost loved ones and their lives must continue on with that loss, right? And again, the economy has been destroyed from it. And, we'll get into what that's going to look like in another podcast. But, the effects of COVID are going to be, people are going to be experiencing this for, years to come. Some people may never recover from this. So, it's just important to note. But so my concern is this. Now that you can keep your mask off, right? According to the CDC, if you've been vaccinated, but now it's up to certain businesses to decide whether or not you have to wear a mask or you don't, or do you need to show proof? We're going to see a lot more conflict, right? If you've noticed, we've been on lockdown for almost a year, and as soon as we opened back up, we've watched lots of just examples of bizarre acts of violence on each other, right? I mean, just road rage incidents, women shooting people, children with AK-47s and shooting at police. I mean, just wild stories, right? And so we see the fights that folks are having because they don't want to wear the mask, and then people are wanting other people to wear the mask, right? These conflicts are there. And so it's summertime, and I think it's going to kind of put us in this false sense of security. And we'll get through summer and we'll come into the fall. And as flu season starts to come back, I think we could see some serious issues happen. And I just kind of feel like this is going to be a concern come, October, November, December into, January and February as we're in flu season. Especially as this, this virus continues to, kind of mutate and change, and, the efficacy of these vaccines, requiring boosters and whatnot. I'm concerned about that. And because the economy was so hurt by needing to shut down, I don't think Americans are going to really accept another lockdown unless the numbers get to, that high level where people are dying by the, 5,000 a day and higher. We're just going to be in a bad way, right? And again, we can't continue to print money either. So you think about, inflation and everything else. I don't think that's going to be an option to shut down. And so I think that's going to, this is going to lead to a potentially really bad situation here in a few months. So just keep that in mind. But again, I'm here at the Kitsap Public Health website. And so they have some new studies here that's cited by the National Institute for Health, where you can read information. There's a printable weekly outlook. Some numbers to know. As of June 2nd, 53% of all Kitsap residents 12 and older had received at least one dose of the COVID vaccine, and 45% were fully vaccinated. More than 118,000 Kitsap residents have received at least one dose of vaccine. 121 COVID cases were reported in our county in the most recent week, with full data that is available from May 16 to May 22. 0 cases on Bainbridge, 23 in Bremerton, 28 in Central Kitsap, 27 in North Kitsap, and 43 in South Kitsap. Kitsap County's rate of cases per 100,000 population over 14 days is a key metric in state reopening plans, has fallen to about 108. COVID-19 continues to spread widely in the county, but the rate of new cases reported has declined since late April. 111 deaths of COVID-19 associated deaths have been reported to Kitsap to date. Find out more local COVID information at kcowa.us/COVID-19 data. me go ahead and put that in the chat for you if you want to click on it. And again, it's nice to have that information, really easy to read and interpret. Here's the outreach toolkit. When you are fully vaccinated for COVID-19, based on the new federal and state guideline, fully vaccinated people may no longer need to wear a mask or distance from others in most indoor or outdoor settings. Click here to learn more. Wear a mask or distance from others at work unless required by the employer. Learn more. Quarantine if they have been exposed to someone with COVID-19 and have no symptoms. To keep each other safe, everyone should continue to avoid crowded indoor events or continue masking in those settings. Continue masking in all healthcare settings, schools, public transportation, and any other settings where visitors are still asked to mask. Follow rules set by businesses and organizations, and stay home when you're sick and get tested for COVID-19. Find a testing site at kcowa.us/COVID-19 or call a local clinic or pharmacy. Okay. And then they have some more information from the CDC or the State Department of Health that you can find right there. So again, a lot of good up-to-date information that's there for you. This printable weekly outlook, I'll go ahead and click on that. And this is just kind of a snapshot. And these are the stats that I've already read to you. But yeah, I think it's really helpful. It's really quick. You'll see their number here if you want to learn more, 1-800-525-0127. Let me see if I can go ahead and capture all of that, and I'll put that in the chat because otherwise folks are like, what is this number? Like, what are we talking about here? It's going to let me do it. Okay, I'll just do that. How's that? Go ahead and do that. Pop that in there. All right, so that's where you can get that information there if you would like more. And then the other thing that I wanted to talk to you about was our governor Inslee has done like what many other states are starting to do, are trying to incentivize folks in their community to get the vaccine. So this was June 3rd. It's about 5 minutes. So I'm just going to read this really quick because you should know about it. All right. For information on all right. So again, our governor has decided to set these incentives for all vaccinated, regardless of when. They're going to include lottery drawings, higher education, financial assistance, game systems, and smart speakers, and event and flight tickets. So here it is. Went up to $1 million, shot of a lifetime. If you're already vaccinated, you're already entered to win. Okay. If not, then get your shot. Hundreds of other prizes, multiple drawings of $250,000. Governor Jay Inslee today announced a suite of new incentives to help encourage unvaccinated Washingtonians to get the COVID shot. The Washington State Lottery will be conducting a Shot of a Lifetime giveaway series during the month of June, working with state agencies, technology companies, sports teams, and higher education institutions across the state to offer a myriad of different prizes to vaccinated individuals. This includes people who have been vaccinated in Washington, regardless of when. The incentives are not just for new vaccinations. The incentives announced today include lottery cash drawings with prizes totaling $2 million, higher education tuition and expense assistance, sports tickets and gear, gift cards, airline tickets, game systems, and smart speakers. Here's a quote here. These generous programs will encourage more Washingtonians to take this life-saving vaccine. Inslee said during a press conference Thursday. I hope people will see this as an opportunity to reopen even sooner than June 30th if we can stay motivated, stay informed, and get more people vaccinated faster throughout the month of June. According to most recent data from the Department of Health, approximately 63% of Washingtonians 16 years or older have initiated their vaccinations. The state hopes that the incentives announced today will entice unvaccinated people to initiate their vaccinations and raise the statewide rate to save more lives and protect more people. Washington is set to reopen fully on June 30, and when the percentage of eligible adults who have initiated vaccination reaches 70%, whichever comes first. Secretary of Health, Dr. Umar Shah, said that he hopes incentives unveiled today help push Washington closer to the 70% reopening goal. A quote by Shah, "Our state has made tremendous progress with well over half of our population 16 and older fully vaccinated. But there are still far too many people who have not started vaccination," Shah said. "We hope this effort encourages people to get their vaccine to help protect themselves and their communities as we push toward reopening at the end of this month." Looking at the cash prizes, starting next week, the lottery will conduct one drawing for $250,000 every week for 4 weeks for all vaccinated individuals. At the end of the 4 weeks, there will be an additional final drawing for $1 million prize. Vaccinated Washingtonians don't need to do anything to be entered into the 4 drawings. The lottery will automatically gather names from the DOH statewide immunization database. The governor was joined by Marcus Glasper, director of the Washington State Lottery, for an announcement. This is Glasper. Washington's lottery is proud to partner with the governor's office and the Department of Health on this important promotion, Glasper said. As the state's principal agency on conducting lottery drawings, we are honored to be able to play even a small role in administering the promotion that helps ensure that our state's residents are healthy and protected as we continue to move toward ending this pandemic. The higher education assistance, Inslee also announced a suite of higher education incentives, including tuition and book assistance at institutions across the state. Nearly $1 million will be dispersed directly to the 4-year public university or 2-year community and technical colleges to run their own drawing for free tuition and expenses for vaccinated students. The state will also be offering 30 prizes of 1 year of tuition college credits to 12 to 17-year-old through the Guaranteed Education Tuition program. That's the GET program. Do look that up because that is actually a pretty good program. These credits will go directly to families. Go ahead and put that in the chat there. Some of the ticket prizes also included in the incentives announced today are various ticket prizes offered by Washington companies and sports teams. Potential prizes include Alaska Airlines, 2 free airline tickets to anywhere Alaska flies, Seattle Mariners, 4 tickets to an upcoming game, full suite to an upcoming game, Seattle Sounders, 4 tickets to a game in August, plus 2 autographed jerseys. That sounds pretty cool. Seattle Storm, 10 tickets, a game for the rest of the season. Wow, that's a big one. Seattle Seahawks, 4 club level seats plus parking passes. Okay. And then the Seattle Kraken, concert tickets, the OL Reign, 4 2021 season tickets, plus a team signed jersey. The game systems and smart speakers. The governor also announced that several technology companies are offering technology and software to help the state's efforts to get people vaccinated. Microsoft will be giving away 300 Xboxes, Game Passes to vaccinated individuals, and Nintendo will be giving away Nintendo Switches. Google will give away 25 Google Nest, and Amazon will be giving away 100 Echo Dots. Okay. Echo Dots, really? Come on, Amazon. Disappointed. Gift cards. In addition to the above incentives, the Washington State Department of Commerce, partnering partnering with the Association of Washington Business and local Chamber of Commerce, will be purchasing $1 million of gift cards to local businesses through local chambers of commerce to be given away at vaccine locations. Commerce and AWB will be sharing additional details soon about the locations and dates where this program will roll out. The Washington State Department of Health will also have a $500,000 in gift card to give away to other summer as part of their caravan mobile vaccination effort. The gift cards will be for different kinds of retail offerings, from groceries to fishing gear to topsoil. The Washington State Parks will also be giving away 80 one-week of free camping gift cards worth $250 each, and the Washington Department for Fish and Wildlife will be giving away 80 $100 gift certificates for fishing and hunting licenses. Also included will be 400 Discover passes, which allow access to recreation on state public lands. Inslee also had to say, choices have consequences. The vaccine is our best and safest chance to get back to pre-pandemic levels of activity, Inslee said. It's a personal choice, but one that affects the lives of millions. The choice we make affects our neighbors, our friends, and our families. So I hope that more people make the right choice to learn more about their safety and efficacy of the vaccine and to get vaccinated. If you or loved one has to get vaccinated or has yet to get vaccinated, you can make an appointment through this vaccine locator at doh.wa.gov. I'll go ahead and put that in the chat there. All right. So again, the eligibility. All vaccine incentive prizes will be drawn from the DOH immunization database to determine winners. The only action that Washingtonians need to take to win any of the prizes is to get vaccinated. All individuals who have been previously vaccinated are eligible. The incentives are open to all Washington residents, regardless of citizenship, but proof of Washington residency is required. Employees currently working for the Office of the Governor, Washington State Lottery, and the Department of Health and their households are not eligible for these incentives. Okay. So I did want to share that with you because a lot of times we don't know about these things. And then even if we do hear about it, we don't get, all of the information. And so we're just not really clear on that. So, pretty cool incentive to try to get folks to receive their vaccination. I might argue that, something maybe they should have considered earlier, but, and I guess it's better late than never. And, you've got to learn, and it's not easy. We can pass all of our judgment in hindsight, but, this thing has been very difficult on what to do and how to do. So they are trying to do something, and so that is good. So I won't even, weigh in on what I think about it either way. So the other thing that I wanted to do while I had you here was just kind of go over some of the local areas that you can get vaccinated if you are ready to make that decision. And so here are some list of upcoming vaccine opportunities. So if you know anyone who is homebound and would like to be vaccinated, please let them know. And this is Kids at Public Health, so that they can connect them to the mobile clinic efforts. Okay. And so the first one is at the Posebo Farmers Market. They're going to have a pop-up clinic. This was May 29th, so that one's already passed. There was a Posebo drive-through on June 1st and June 2nd, and then here's one on June 3rd. So the next one, the last one, will be the Bremerton Walk-In Clinic, which will be this Tuesday coming up, June 8th, from 5 p.m. to 8 p.m. The address is the Kitsap Immigrant Assistance Center, 3627 Wheaton Way in Bremerton. And this is behind El Campesino. There is no appointment needed. The vaccines that are available are the Johnson and Johnson. This is a 1-dose series, and there's a patient fact sheet here for new folks, and a second dose only for the Pfizer returning folks. And there's a patient fact sheet there, and everyone 18 and older is welcome. And if you have any questions, you can contact Holly Balstead. She is the COVID program community liaison. Her information is there. Okay. So I wanted to share that with you as like I said, I do this vlog on, how I'm feeling every day. I will be putting out information as I get it from the county. And as I always tell you, again, if you need transportation to get your vaccine, we are providing free transportation to your vaccination site and back home. And as I was sharing with you, Rob and his wife got their vaccine at Walmart. So might be a pretty cool idea if you're like, hey, I got to do some shopping anyway. I'll have them schedule a time to take me down to get my first vaccination, and I'll get my shopping done too, and I'll get a free ride out of it. So, we'll wait for you or come back if you're going to do some shopping, and then we'll get you back home and there's no cost. So please do consider reaching out because we are here to serve you. And that's what we want to do. We feel great when we're being used. So please take advantage of that. So that is the update. I will tell you, I'm a little concerned about receiving the second vaccine. I don't know, what these side effects are going to, how they're going to impact me if I do receive them. I've spoken with a lot of people, and honestly, it's been, I'd say maybe 60-40 folks that were like, hey, I got it. 40% said, I got it, and I was fine. I thought I was going to get sick, and I didn't get sick at all. And then I'd say about 60% of folks, had experiences of, I got really sick for a couple days to, I didn't feel really good that first day. Second day, I was like, just kind of tired and lethargic. But after that, I was fine. So just kind of a little bit in everything in between. But like I said, I want to, try to provide you as much accurate information as I can on what my experience was, especially since, this kind of attacks the lungs and, I've got a lung issue. So I thought that might be helpful. As always, I do want to leave you with the Summer Prime basketball tournament that is coming up July 30, 31, and August 1st. You can go to ksptournament.com and register. There is going to be over $1,400 in cash and prizes. There's going to be a 3-on-3 and a 1-on-1 divisions. The deadline to register is July 15th. And don't worry about if you don't have a team for the 3-on-3. Just go ahead and register, and we will get your team together for you as more people sign up. There's a $25 registration fee, and there is free registration available for those that aren't able to pay the $25. So go to the website for more information. And the hope right now is this thing is going to be just a good time, right? As you know, AJ, shout out to AJ, is our 15-year-old Kitsap, Central Kitsap high school student who just feeling, having a lot of passion and compassion for his fellow students and fellow community folks, and wanted to do something to kind of bring people together. And what a great idea to have a 1-on-1 and a 3-on-3 basketball tournament, middle of the summer, getting people out. Kids at Public Health has donated, $5,000. They will actually be on site, and so at that time, I think children 12 and up will be able to get the vaccine. So on that day, you can get the vaccine. They will be there all 3 days. And so we plan on having a good time. We'll have games, raffles, food, just a little bit of everything. So please stay tuned on that. If you want to participate, if you want to have a booth at the event, you can reach out and contact me. And that's at 360-373-3000. Okay. Because I am managing the vendor, kind of duties on that. So let me know so we can get you set up. And this is a great opportunity for other people to know who you are, right? As we're trying to get back to whatever the new normal is. My in camera here, the new normal is. And so, everyone's businesses have been impacted. And so this is a good way to kind of come back out and get back in touch with the community. If you want to participate or help into making this thing a success, please reach out to me. I could definitely use your help because this isn't something that I've done before, but I do want this to be a Big Ten event and have it be as fun as possible, right? And again, a great opportunity to participate in the tournament. For those of you that don't want to play 1-on-1 or 3-on-3, the plan is to have a 3-point contest, or someone even said a dunk contest earlier. So, I don't think I'll be participating in the dunk contest unless it's like an 8-foot rim. But there'll be raffles and prizes and just kind of all kinds of different things. But, again, we've had a really hard time in this country over the past, 2 years or so. And for us, if we're going to try to find ways to connect on whatever new levels, old levels, and try to work through, the issues that we have as a community, as Americans, then, we have to, be the folks that do it, right? We can't expect the government to do it. We can't wait for someone else to do it. We have to be the one that reaches out our hand, right? And so that's really what really moves me about AJ wanting to do this. And so when he came to us and asked, I was all in on trying to find a way to try to help support it, right? Because we do need to heal, and we do need to find ways to grow together as a community. And so what better way than to have a tournament, and have a lot of fun and games and everything around that, and just try to create spaces for folks to come together and just have some fun, man. Just have a good time, spend some time together, learn about, things that are going on in the community, learn about people's businesses and what they do, eat some good food, have some fun, win some prizes, and just kind of support each other. So that's what this is about. Again, the 3-on-3 1-on-1 basketball tournament will be July 30, July 31, and August 1st. So that is Friday, Saturday, and Sunday. Do go to ksptournament.com to register. Again, there's more information there. You can see there's quite a bit of prizes. There is a registration fee, as I said before, but if you have some challenges with paying that registration fee, there is a way to get that waived. So when you go to the website, you will see that information. Okay. So again, this is coming up. Shout out to Kids at Public Health and Washington, All in Washington, for their contributions and sponsorship. Shout out to New Horizons Baptist Church for their sponsorship and donations. And also shout out to Up From Slavery, because I believe they also are going to be sponsoring and donating to this event to make sure that this event is a great success. So again, if you are interested in playing and participating in the event, go ahead to the website and go ahead and register. If you want to, help out, or if you want to have a vendor table there, please go ahead and give me a call at 360-373-3000, and I will provide those details. And let's go ahead and have a good time. We need it. We need it, Kitsap. We have been through it. And, the future will be dictated by what we do and how we do it. So that is the update. Again, you'll see me tomorrow morning at 10 a.m. getting my second shot, and you'll see Raymond getting his first shot. And I tell you, I would have wagered $1,000 to tell you Raymond would not get that shot voluntarily. So, hey, I tell you, it can happen. It can happen. All right. I'll see you guys next time. Bye-bye.